What we're actually seeing is a hospital system under stress, a hospital system in crisis, and the Barnett government simply doesn't care.
Labor swept to power in an unprecedented victory.
The latest statistics point to the ramping problem continuing to be far worse than it was in recent years.
But we are working on longer term plans to make sure that we put downward pressure on ambulance ramping.
WA's ambulance ramping crisis has reached new heights.
We've increased hospital spending. We've increased health spending. We're spending $14.2 billion this year.
The Commonwealth contribution, both in terms of the number of aged care beds and in terms of the number of home care packages, is underdone.
I am responsible for what we do, which is record investment in health.
We have been working our way through a very difficult winter season. We've had high levels of flu as well.
WA has recorded another month of record ambulance ramping, despite the postponement of 100 elective surgeries.
This is unsafe. This will lead to disaster. Our hospitals are in a state of crisis.
It is time for the Premier to step up with real solutions, not to blame an ageing population, a winter flu season, a growing population, or the federal government. All of these things could have been mitigated.
I think the challenge with prioritising investment in prevention is, frankly, the political cycle. It's a challenge for any government to say we're going to invest in something today that we won't see potential benefits for 15 to 20 years.
President-elect of the Australasian College for Emergency Medicine, Peter Aleli, welcome to Stateline.
Thanks for having me.
How bad is it in emergency departments for you and your colleagues at the moment?
It's the worst it's been in the 18 years I've been in WA emergency departments. There's almost an unhealthy fixation on ramping by everybody, and that's perversely leading to increased risk in our emergency departments because we are getting phone calls on a daily basis to get people off the ramp who aren't fit to be got off the ramp, and then bad outcomes are happening. We've almost moved on some days from the traditional triage process of seeing people and by order of priority to almost like a disaster situation where we are triaging, but in some respects we're not. We're just sieving and sorting like you would in a disaster situation where people who have obviously immediate life threats are still getting seen. And I don't want to put anyone off coming to emergency departments. You will still get excellent care if you've got an immediate life threat, but it's the group that aren't immediate life threats, aren't obvious immediate life threats, who are getting put in our waiting room that frighten us the most, because they might reveal themselves as having something horrible wrong with them while they're sitting in our waiting room.
How much of that is avoidable?
I guess potentially all of it. When you look at the issues underlying it, it's amazingly complex. But a lot of those issues could have been addressed over the last 15 to 20 years, and we could have been in a much better situation today.
What would that have looked like?
That would have looked like increased community care, increased primary care, and increased hospital capacity.
The government constantly talks about the billions it's pouring into health, the hundreds of millions it's putting into aged care. Why isn't that enough?
I think that investment is really welcome and that really great. It feels like too little too late. I think the complexity of health means that any changes you make today are likely to take many years to have a benefit.
What have been the big changes in patients and the work in EDs over the 18 years that you've been in them?
People do not turn up to the emergency departments with one thing wrong with them anymore. They've got 5 things wrong with them. And that's a testament to the advances that we've made in healthcare, that people who would previously have died with that one thing are now living and surviving and thriving. The number of over 85s attending our emergency departments are conservatively predicted to increase by over 500% between now and 2050. And we are just at the beginning of that exponential curve, and you've seen how bad the data is from our emergency departments at the moment.
What is the first thing that needs to happen?
I would very much, and all of my colleagues in Western Australian emergency departments would very much long and wish for the Premier of Western Australia to be standing in front of a brand new hospital in 7 years' time, opening a 1,000-bedded hospital for us.
What happens if that isn't what happens and we don't get that extra capacity into the health system?
What happens is that you will see ramping figures over $10,000 in the very near future, and you will see increased risk and increased bad outcomes in the emergency department.
Dr. Peter O'Lely, thank you very much for your time.
Thanks, Keane.